Reduce the isolation that goes with caregiving. Make sure your neighbors know that you have someone in your family that you're caregiving for, especially if they have cognitive impairment, because people will leave the house and not know how to get back. Make sure that your police department, your fire department, your neighbors all know that you're taking care of someone who has cognitive impairment. There's nothing to be ashamed of. Asking for help is not a weakness. It's actually a strength to be able to say, I need help, and I'm going to say something.
Did you know that in 2020, there were 53 million caregivers in the United States? And by 2025, this number is expected to grow to 62.5 million. 73% of these caregivers also have a job. They are called working caregivers, and they are invisible because they don't talk about their caregiving challenges. Working Caregivers, the Invisible Employees, is a podcast that will show you how to support working caregivers. Join Selma Archer and Zach Demopoulos on the Working Caregivers, the Invisible Employees podcast as they show you how to support working caregivers.
Good morning, good afternoon, good evening from whenever and wherever you are dialing in. We thank you. This is Working Caregivers, the Invisible Employees podcast, and my name is Zach Demopoulos.
And I'm Selma Archer.
What's up, Selma? How are you?
I am fantastic. How are you, Zach?
I'm great. We literally have a guest that's exactly between us. You know, I'm on the East Coast, you're on the West Coast, and our guest today is right smack in the middle.
Awesome.
Kind of.
Awesome. Welcome, Dr. Johnson.
Thank you so much for having me. Glad to be right in the middle.
Our pleasure.
Yeah, well, we're happy to talk to you today. One of the things that raised our interest when we saw your article, Caregiving Without a Net. And just the title itself is intriguing. So we had to take a dive and take a look at it. And it's just so informative, very well done, thoroughly done, and some interesting findings. So we're going to chat with you about that today, if that's okay with you.
Yes, I'm okay with that. I'm always up for that. Thank you so much.
Okay. So in your article, Caregiving Without a Net, you highlight some of the at-risk populations in terms of caregiving. What were some of your most interesting findings? What did you not expect to find?
What really surprised me were two patterns that came out of the survey that we asked people. I was surprised to find out that a higher proportion of men reported that they cared for someone that had attended adult day service programs, which is what my focus was in for this study. And although we know that women carry the load of caregiving, we had 11.7% of our male participants say that they had actually taken care of someone who used adult day program services. Just the fact that men led the way to say that they use the services, it suggests that when men are caregiving, they're more apt to ask for help. Whereas women feel like, I can do this, I have this. And in the Black community, Black women there's a syndrome called the Superwoman syndrome, where they feel like, I've got this. I don't need help. Nobody else can take care of my mama like I can take care of my mama. So it was very surprising to see that men actually use services more. And then the second thing that stuck out to me was that only 1 in 4 Hispanic respondents said that they had actually used support services, the adult day service, whereas Black and white caregivers, only 7% said that they had used adult day services, which again looks at the diversity. Is there cultural differences between these three groups? And what's making it easier for Hispanic caregivers to use these services versus Black and white caregivers, which I would have thought it would have been the other way around, that white caregivers would have used it way more than Hispanic caregivers. But it could also show that maybe there's some differences within groups of navigating through these processes. Again, intuitively, I would have thought that white caregivers would be able to navigate the scene a lot easier than the other caregivers.
It looked like all of the groups mentioned not having enough support from family and close friends. Can you talk a little bit about that? Why is that the case?
So when I did my dissertation, I had a small focus group, and we looked at that. We looked at social connection, your social network. What we found was that a person may have a huge social network, a lot of siblings in the group, cousins, but the person who's being taken care of usually zones in on one particular child, family member. And it's usually someone that's a nurse or has some kind of healthcare experience. Yes. So when that person zones in on this particular caregiver, everyone else just falls back most of the time. We had a gentleman that talked about taking care of his aunt because she was never married, didn't have kids, but he had siblings. And he said, when I would reach out to my siblings or my cousins to say, hey, can you come help me with auntie while I go run my own errands, he would have to pay them. And he said, I don't get paid. I'm doing this out of love for our aunt. So again, it's not necessarily the amount of people you have around you. I think it all looks at the relationships maybe that people had prior to taking on this caregiving responsibility, as we like to say in our field, being voluntold to be a caregiver for whatever the requirements are that you met. You have been voluntold, and everyone else just falls back. The few people that I've talked to where everyone had really chipped in, you know, they come and they relieve the person, or they live out of town and they say, okay, every month I'll come on this day and stay for a week. Those are really the outliers that I have seen, but I have spoken to several families who have been able to do that.
I got so many questions on everything you've just shared. So many, but I'll stick to just a couple. Well, first of all, I'm a male. I'm guilty of not actually asking help when I was caregiving in the beginning. The second go around, I did definitely raise my hand. And I also was the cause of my siblings falling back because I didn't include them. You know, there were some issues there, but that's really interesting research to hear that. And by the way, I have a Greek mother who definitely would agree with women of color and say, I've got this, don't back away without a doubt. What got you started in this kind of work, Dr. Johnson? And what other type of research do you do?
Oh, wow. This is amazing. Thank you so much for asking that question. When I think back to why I got interested in this work, and actually the research part of it came later. I think back at it now. I was raised by my grandmother, my sister and I. So as I start to look back, I say, well, maybe that's where it really started, me learning about caregiving. And we only had her for a little bit before she passed away, but the things that she instilled in us, I still carry today. My mother was in a near fatal car accident when we were 12 and 14. And when we went to visit her in the hospital, she just was not well taken care of. And then they discharged her home to two young kids, no home care at the time, no services, no support. So we would take care of her in the morning and then go to school and come back and start it all over again until she got better about a year later. Wow. And then fast forward to my adult life, my soon-to-be husband, his mother was voluntold by her husband to take care of his sister, who at the time was diagnosed as being senile because we didn't have dementia and Alzheimer's at that time.
Right.
So my Johnny Mae would take care of her sister-in-law, Bert, all day, then leave to go to work second shift at the hospital, come back and start it all over again. So not, as you're living your life, you don't think about how these things impact you, but obviously they did. And then moved closer to me getting into this work, I had a friend who was a nurse for over 40 years. Her mom was having symptoms of dementia. She didn't recognize it. She didn't know where to start to find diagnosis, to find resources, even though she was a community nurse. She would help other people find things, but she couldn't help herself. So once I was able to get her through the process, I said to myself, you need to go do this on a much bigger level and be able to impact the science and help caregivers, because the caregivers are really the backbone behind our health systems.
Right. Yeah. 63 million of them out there, actually.
Yes.
Yeah.
Unpaid, untrained, unsupported. Yes.
Yeah.
Yes.
So also just to help with our audience, you mentioned adult daycare. Was that part of the help that men would ask for, or were there other things as well? Or was it mostly adult daycare?
Yeah, we focus mainly in adult day service. And I'll
Okay.
tell you why. When I was going through doing my dissertation, the literature just kept saying Black caregivers don't reach out for help. They don't reach out. I had a few experiences where a gentleman had a grant program in Detroit and he wanted it to be for Black caregivers. He said he could not get one Black caregiver to apply. He would go to them and say, hey, I have this grant. And they said, oh, no, let Johnny next door take it. I don't need it. So I decided when I was finished with my program, I wanted to kind of flip the script and look at support services that are out there. Find out, how are you letting Black caregivers know that you're there? How are you making it affordable for them? How do you make sure that they can access you? So I chose adult day program because I thought everyone has heard of it, which I find out later is not so true.
Not true.
So I called adult day services in Wayne and Washtenaw County, which is Ann Arbor and Detroit. Those are the two big towns. I call these facilities as an adult child of someone living with dementia. So this is what we call a secret shopper. So I'm calling asking, hey, tell me about your program. What do you do? How much does it cost? What are your hours? Do you provide? What services do you provide? It was really an eye-opener to find out that there was so much lack of standardization. In Michigan, there's no requirement to be registered. There's no one location where you go to find out where the adult day programs are. And also, a lot of them closed after COVID, and maybe half of them came back into service. And when I asked the providers, how do people know that you're there? Everyone said word of mouth. And I have to tell you, as a person, I was not even providing care. It took me 3 or 4 phone calls at times to reach people. So imagine if I was truly caring for someone who had dementia, how hard that would be to make these calls and have to keep track of who called me back and who didn't call me back, trying to compare and see which site would best fit my needs.
Thank you for sharing that. I mean, I ran a home care agency for 13 years. I didn't know what adult daycare centers were until I first started working in that business. And I would go and visit so I could promote their services. So I think that was a great example. Last question on this subject. Well, actually, more broadly, as you were doing this research and work, was there a particular category of caregiver that you find to be more vulnerable than others by any chance? And what would be the reason for that?
Well, I would say caregivers in general are vulnerable just because of the work that they do. Untrained, unpaid, unsupported. But those who provide care to people living with dementia are especially vulnerable because it's physical, it's emotional, it's financial. And sometimes when you have the person living with the caregiver, there's no break. It's 24/7. Some of them are what we call sandwich generation. So they're taking care of the person living with dementia, but they're also taking care of a child within the home, and they're still working. So we find that Black caregivers and Hispanic caregivers tend to carry the load of that. When you think about the fact that Black people are twice as likely to be diagnosed with dementia and they're diagnosed later in the disease process. So by the time they get the diagnosis, the caregiver has been trying to manage these behaviors and outbursts that they had no term for. They don't know what it is, how to handle it. So the burden is really heavy on the caregivers.
You talk in your article, you dedicate a section to talking about financial strain, which is just so enlightening. Can you share a little bit about the tension between the financial strain of having to work at the same time, the expectations on your job and the expectations of that family?
Caregiving, especially for our older adults with multiple diagnoses, it's not a short-term situation. Most of the time, it's long-term. I've attended programs where people say, I went into it thinking I was just going to be doing this for maybe 2 or 3 years. And 20 years later, here I am. There's no off-ramp. It's once you're in it, you're in it.
Yes.
So people who caregive, they still have to work. There's appointments to be made. Your person might be well for 2-3 weeks and not have any problems, but then they may have a fall that requires you to now have to start making appointments and going to see specialists. But our system has nothing in place to address that. When you're young and you're having babies, there's time off, maternal and paternal leave. But with caregiving for older adults, there's no way to predict when that time off is going to be needed. So the caregivers tend to end up paying for all the needs of the person they're caring for. And it's little things that add up to a lot. Incontinence pads, personal care things, maybe co-pays for the pharmacy, co-pays for the physician. So all these little things add up. And the schedule is so unpredictable that maybe I have to leave work now and take a few days off, and I may not get paid for it, especially if we have people who are working shift work. You may not have enough time PTO to take the time off. I know you didn't ask me, but I'm going to tell you, my recommendation, what I would love to see, is a family leave that actually addresses this. We need employers to be more flexible with people who are caregiving for their older adults and their families. And we need to make sure that we're providing them the benefits, connecting them to support and community services that can help them stay in the workplace. These people, they want to work, but what are you going to do with your mom, your uncle, your aunt, if they need help?
You mentioned financial gaps that are in the caregiver support system, employers being a little bit more flexible with their leave policies. Any other gaps that you're seeing, and what would you say is probably the most critical today?
Okay, so we talked about adult day program. It's not free. It's not covered by Medicare most of the time. If a person has Medicaid, they may have it covered.
Right.
But what I found with my secret shopper was that one site said, oh, we received a grant, so it's free for everyone until the grant runs out. Up to some people were charging $190 an hour to have your family come there. None of that is covered by insurance. So we're telling people this is a respite. You can use this to practice self-care, do for yourself. But if I have to pay for that out of pocket, I'm not going to be able to do that. I don't have the resources to be able to do that. So we need not only state level discussions about this and how do we fix this, we need the federal level to also come in to support these caregivers. Within the federal landscape, we should have caregivers in Washington being at the table when these discussions are being had, because they're the ones that are going through it and can give you for sure, step by step, what they need and what would work for them the best.
Thank you. And just a quick shout out to the National Alliance of Caregiving and Jason Resendez, who is on the Hill and is trying. He's trying, Dr. Johnson. He is. He needs more help, but we go to his event every year, and he does a great event.
Yes.
But thank you for sharing that.
So, Dr. Johnson, in addition to the flexibility that you mentioned, that employers could certainly help, support their working caregivers, is there anything else, any other role that you see employers could play in helping to alleviate some of the conflict, between work and caring?
I think that employers can look at their benefits and see within their benefit package, how can we address this issue for our employees? They can be more flexible with their schedule and not be so punitive against people who have to take the time off. Given the opportunity, most people want to work. And if I have been a good long-standing employee, when I need this time, this is not the time for you to hold me against the wall and say, no, you have to come in no matter what's going on in your family. And that's where this mental health and well-being poor outcomes happen, when people have to choose between going to work and taking care of their family member. Besides the adult day service that we talked about, we don't have anywhere else to bring our older adults if their family members have to work.
Well, one of the things that we found, and Zach and I found in our research, is that when people have to make that choice between their job and their loved one, they choose the loved one.
Yeah, exactly.
They leave the job.
Yeah.
So the employer actually is the loser in that
Yes.
situation.
Exactly. And I wish they would recognize that.
Why do you think that is, Dr. Johnson? Because I was on a webinar right before this podcast. They polled employers, and 25% of them were providing benefits specifically for elder care, but only 12% of the employees even know about them. So maybe
Yes.
their situation. So you feel like maybe there's just not enough communication about it, not enough storytelling, not enough.
All of that. Yes, that is so true. When we leave information sharing to word of mouth, we lose a lot of people. The employers have to understand that if you provide a service, a benefit to your employees, it's important that you spread that word. For us seasoned people, we don't look at just the pay, the hourly rate. We start looking at what benefits are being provided. So if you're providing such a great service, celebrate it. Make sure that everybody knows about it. They should be having group meetings with their employees to say, this is the new best thing that we're offering you. Make sure you're taking advantage of it. That's why we're offering this. During my time working with nursing homes, I found out that leadership has a lot of information, but it rarely trickles down to the frontline staff. And those are the people who need to learn that stuff.
Yes. And use any method possible, like catchy titles like Caregiving Without a Net. I mean, look, that's catchy. I love that. When Selma and I saw that, we're like, let's find out what this is about, and let's get the leader over here to talk about it. On that subject of employees, let's talk to them. You and Selma just talked about the employer. How about the employee? If there's an employee who right now listening to this who feels like maybe they are without a net, whether they know it or not, what kind of advice would you give them right now, things that they could tangibly do to try to start building a net under them?
The first thing I would recommend to anyone who's caregiving, employee, family member, get to know your local area agency on aging. We call them the AAAs. They serve as a free entry point to information about respite, adult day programs, caregiver support groups. They offer financial assistance. There are programs that will help you modify your home for your loved one. That would be one of the first things they do. They're actually the ones that provide like Meals on Wheels if people need it. I would also encourage people to talk to their primary care provider. Unfortunately, this should be the first entry into support service. When you get that diagnosis, I have been singing the song of, we should be connecting people to caregiver navigation. You get the diagnosis, I send you to the social worker. The social worker says, oh, mom, dad, auntie, this is their diagnosis. Here are some of the resources that can help you here are some definitions. Here are some behaviors that you might see. It's a lot right now, but I'm giving it to you. If you need me again, reach out to me and we can walk through this again so that caregivers are not out here flailing on their own. We should also have them connecting with caregiver support groups. A lot of them are virtual now. If nothing else, COVID taught us how to be flexible and not think that we always have to be in person to get the care that we need. They should also reduce the isolation that goes with caregiving. Make sure your neighbors know that you have someone in your family that you're caregiving for, especially if they have cognitive impairment, because people will leave the house and not know how to get back. We've all read stories about someone leaving in the middle of winter without shoes, without clothes, and then we find them in the snow. Same thing in the summertime. They're walking and they end up, in the woods or maybe in the car with the heat. So make sure that your police department, your fire department, your neighbors all know that you're taking care of someone who has cognitive impairment. There's nothing to be ashamed of. Asking for help is not a weakness. It's actually a strength to be able to say, I need help and I'm going to say something. Finally, if they're working, they should check out their check out their handbook, find out what programs the employer offers, ask about caregiving leave way before you need it so you can be prepared. Is there an employee assistance program that you can tap into? And then, is there time for you to sit and talk to people within your business, your office, to find out, I don't need it now, but I would like to put a roadmap out there for when I do need it. So being prepared is half of the battle.
You speak like you're talking from lived experiences. That's very, that's a very great list of things to start building that net. Thank you for sharing.
Yes, thank you.
Just one more, maybe summary question around respite, because it is so critical. And I know during my care journey, my first care journey, it was really, really very critical for my own mental health and physical well-being, just to have that place I could go, for a week or so and step back and just relax and kind of rejuvenate. In your data, it says that the 57% of caregivers have never used respite. That is amazing to me. I mean, even though 32% said they'd heard of it, but 57% have never used it. Why do you think that is? And how can we change the narrative on that?
I don't think that we're defining respite properly for people. And respite doesn't always mean that you have to go somewhere or that your person has to go somewhere. Yes. So, in research and in healthcare, we have our terminology that we use, but it doesn't resonate for the layperson. We need to say things such as, are you overwhelmed? Are you tired? Do you need... So even if it's just someone coming to sit with your person while you go take a walk, someone picking up the medications from the pharmacy so you don't have to figure out how to get your person in the car. I had a coworker who was telling me about the person she caregivers for. She says going to the grocery store is like a whole journey. We have to put the walker in the car. I got to put her in the car. And then I have to get there and just reverse it. She says a lot of times I don't go to the grocery store because I can't afford to have her come with me. So the little things that other people can do for you to help you. What I did learn in my studies is that if the person you're caregiving for says, I don't want to participate in whatever that respite is, it doesn't happen. Because I'm not going to tell my mama, oh, yeah, you going. Mama's going to be like, no, I'm not. So it's done. I had a gentleman who put his wife in the most beautiful adult day service. He said it was so wonderful. I wanted to go there. She was there less than 2 weeks, just causing a ruckus. She wanted her husband. She didn't want any of these people. She threw a tomato at somebody's head. They called them up and said, come get your wife. And that was the end of that. So, I say all this to say, let's not box ourselves in. Think of different ways that you can help your mental health. Even if it's just being able to just go in your room for 5 minutes while your person is watching TV, take advantage of it. If your person loved to walk before and are still able to, make a plan for how are you going to get outdoors and do the walking with that person. Did they like to garden before? So don't automatically say they can't do this anymore because whatever their illness is. They might be able to sit on the bench right next to you and hand you the bulbs as you're putting it in the ground. Did they like to color? Were they creative? Get some coloring books. Did they like to play cards? Even if they don't recognize what an ace of spade is anymore, just get the cards out there, get them doing something that they enjoy doing. For people who live with cognitive impairment and dementia, they may tell you, oh no, Selma did not feed me today. She didn't give me a bath today. But they can tell you what happened when they got married 50 years ago. They can tell you what happened when they were in the army with full details. And that's why I love taking care of older adults, because when you sit and listen to them, there is so much knowledge that they bring, and they are brutally honest in their assessment of people. So I say all that to say, I'm sorry, that take whatever, ask for help. When people offer it, do not turn it down. Yes, you need that help. Take it.
Yes.
You got a lot of passion for
Yes.
this. I love it. What's next for Dr. Johnson? What are you working on next? Can you share?
Yes, I am working on connecting with caregivers to find out, okay, I've done this study now on adult day program. It's supposed to be this wonderful thing. Does that work for you? What would you like to see as a support service? And if you do go to if your person goes to adult day service, what do you do with that time? Are you out making extra money or trying to get an extra shift in? Or are you using it as a respite to take care of yourself? And we have to encourage our caregivers to take the time to take care of yourself. Because imagine if you overwork yourself and you end up in the hospital, what's going to happen with your person? So always think about outcomes of not practicing self-care.
Awesome.
So
Thank you.
based on all of your research findings and your study and the work that you're embarking on now and the work that you've done in the past, what can you leave us with as a message of hope around caregiving? Where's the hope? Where's the light?
I know that there's a light at the end of the tunnel, because caregivers, when they organize, they are a force to be reckoned with. And I think that I work on lived experiences. I don't want to be in a sterile lab. I want to be in the community. I want to talk to caregivers. I want to co-create things that are going to work for them. And when we take that approach, there's always going to be a light. There's always going to be hope. But when we talk to them as if they're out there somewhere and we're the ones that know better, it will not get better.
Okay. So one last question, how can people who are listening right now, how can they find out more about what you're doing and what you're planning to do in the future in the care space and get connected with you on some of these initiatives?
Well, I am trying to be better about posting my work on Facebook. I'm told by my children that only old people like us are on Facebook, but I'm working harder to be better with that. But professionally, I post a lot of my work and my research on LinkedIn, and they can find me just by searching Florence Johnson. Also, if people are in the Ann Arbor market, go blue, just look me up on the University of Michigan School of Nursing website.
Awesome. Well, thank you so much, Dr. Johnson. This has been so enlightening and so very helpful. We're so thrilled that you joined us today. So thank you.
Thank you for the opportunity. I love talking about my work, and I tell people all the time, no matter what's going on in my life, when I get in front of caregivers and talk about my work, I come alive.
We could tell just a little bit. We could tell.
Yeah. just a teensy weensy bit.
Thank you. Thank you, Dr.
Thank
Johnson.
you.
We're looking forward to to more great work from you, because we need it. We need validation, unfortunately, right? Even large employers who want to do the right thing, of course, but they also need to see the data, right? So, so thank you so much for the work you're doing. Take care.
Thank you so much. Have a great day.
Thank you for tuning in. Be sure to catch new episodes of Working Caregivers, the Invisible Employees podcast, every other Tuesday. Please also visit our website, invisibleemployeeadvocates.com, to subscribe to our newsletter, purchase our book, and learn more about how we can help you strengthen your workplace to become more supportive of working caregivers.